morning to all the delegates. Myself, Sai Divya. Today, my paper topic is Study to Determine Prevalence of Primary Open-Angle Glaucoma in Patients with Systemic Hypertension. Introduction. Glaucoma is a chronic progressive optic neuropathy characterized by recognizable patterns of alterations in the structure of optic nerve head and nerve fiber layer of retina and consequent visual field defects. It is the leading cause of irreversible blindness worldwide, second only to cataract, accounting for 14% of global blindness. And India accounts for 23.5% of global blindness, with 12.9% of primary open-angle glaucomatous blindness in the world. Globally, primary open-angle glaucoma affects more people than primary angle closure glaucoma, with an approximate ratio of 3:1. Risk and prognosis of primary open-angle glaucoma is influenced by demographic factors such as age, race, and family history, and by several ocular parameters including myopic refractive error, optic disc shape, and corneal thickness, systemic factors like blood pressure and diabetes. Increased intraocular pressure is the most important modifiable risk factor for POAG. Evaluation of hypertension as a risk factor for POAG in our population is essential so that the disease can be detected at an early stage by screening these high-risk groups. Aim to find the prevalence of primary open-angle glaucoma in patients with systemic hypertension. Materials and methods. A cross-sectional case control study was conducted from November 2022 to April 2023. Cases are subjects with primary hypertension and controls are age and sex matched subjects without hypertension. Patients underwent detailed ocular examination including IOP and blood pressure measurements, followed by perimetry gonioscopy using Goldman's 3 mirrors done for all subjects with IOP more than 21 millimeters of mercury or cup disc ratio greater than or equal to 0.5 or asymmetry greater than 0.2. My inclusion criteria are patients with documented systemic hypertension on antihypertensive medications, patients above 40 years and age-matched non-hypertensive controls. Exclusion criteria are patients less than 40 years of age with secondary glaucomas and patients with diabetes and with known family history and any corneal scarring or opacity on which gonioscopy can't be done, and previous ocular trauma or diseases other than primary open-angle glaucoma. My results are age distribution of study subjects. Mean age of subjects with hypertension was 57.94 years, and in non-hypertensive group it was 57.55. And age distribution of glaucoma patients, mean age of patients with glaucoma was 63 years. And gender distribution of study subjects, females were more with accounting to 55%. And in POAG patients in hypertensive group, 3 were males and 2 were females, and in non-hypertensive group, 2 were males and 1 were female. And blood pressure in patients with POAG, in hypertensive group, blood pressure we had was 143.11 out of 88.9 mmHg, and in non-hypertensive group, mean blood pressure was 115 out of 75 millimeters of mercury. And blood pressure in patients without primary open-angle glaucoma, in hypertensive group, it was 138 out of 88 millimeters mercury, and in non-hypertensive group, it was 116 out of 74 millimeters of mercury. And duration of hypertension, most of them were had hypertension for a duration of 1 to 5 years with 17, next come 5 to 10 years, and less than 1 year, and the least was more than or equal to 10 years. And duration of hypertension and primary open-angle glaucoma, out of 5 patients with glaucoma in hypertensive group, 60%, that is 3 out of 5 were hypertensive for more than or equal to 10 years. And mean IOP in hypertensive group was 17.30 plus or minus 3.268, and in control group it was 16.02 plus or minus 3.250. And intraocular pressure and glaucoma, there were 8 patients with primary open-angle glaucoma. And prevalence of glaucoma, we have 5 POAG cases with hypertension and 3 were without hypertension, contributing total of 8 out of 100 patients of total subjects. And discussion, out of 100 subjects studied, 8 of them were found to have glaucoma, amounting to an overall prevalence rate of 8%. Percentage of prevalence in hypertensive group was 10%, and in non-hypertensive group it was 6%. Among 8 patients with POAG, 37.5, that is 3 out of 8, were below 60 years of age, and 62.5, that is 5 out of 8, were above 60 years of age, which suggests that occurrence of POAG increases with increasing age. there was statistically significant difference in the mean intraocular pressure of hypertensive subjects when compared to non-hypertensive subjects in our study, with IOP of hypertensive patients being higher. Conclusion: results are insignificant to consider systemic hypertension as an independent risk factor for glaucoma, and persons with longer duration of hypertension and advancing age need to be monitored for high intraocular pressure and optic nerve head changes to aid in early diagnosis and minimize visual morbidity and blindness due to glaucoma. These are my references. Thank you.
What is the criteria to say open angle glaucoma?
Sir,
What are investigations you have done to confirm a case as open angle glaucoma?
Sir, I went with measurement of intraocular pressure by Goldman applanation, and I've seen the fundus, sir, and I've done gonioscopy.
You have not done a visual field analysis?
Yes, after that I've sent for visual field
It's
analysis.
not in your slide. There is no mention of visual field analysis.
Yes, sir.
So how did you come to a conclusion that it's a case of primary hypertension? Slide, please. Were you in consultation with a general physician? Say it's a primary hypertension.
Yes, sir. I've combined with done with the general medicine. I've coordinated with them, and I've took cases from.
So
there.
did you rule out those cases of secondary hypertension?
Yes, sir.
You have done or the physician has done?
No, they've given me just the case. For cases, I've coordinated with them, sir.
So you have gone to a general medicine department, picked out 100 patients from there, and you brought them to your OPD and did glaucoma checkup for them. How I did not understand actually from your presentation.
Yes, I had coordination with the general medicine people, ma'am, and I took the cases from there and have evaluated for this intraocular pressure and fundus changes, followed by gonioscopy.
So randomly you picked up. How did you pick up only those 100?
Like during this study period, I've.
So every day you were going to general
Yes,
medicine
ma'am.
and what is the definition of hypertension in your study? And how was the BP measured?
Manually, it was measured, ma'am.
Do you have any standard way of measuring BP if you are doing such a study? Is it first time or how many readings have you taken?
3 readings, ma'am.
Is it mentioned anywhere in your paper?
No, ma'am.
So most important thing is you have to define hypertension when you are talking about glaucoma in hypertension.
Okay, ma'am.
And you have not mentioned anywhere that it was conducted in coordinates with some general medicine department or anything. So first and foremost you have to define what is hypertension, what is the systolic BP, what is the diastolic BP which you have taken, how many readings you have taken, what is the measurement, like how you have taken it, whether it was done in sitting position or lying down position, who has taken it, is it always one person has taken, is there any inter-observer variability?
No, ma'am. Only one person, ma'am.
Always one person with the same BP machine?
Yes, ma'am.
So all that should be included.
Okay.
You have not defined what is hypertension in the study of what is important here, you have not